Hello everyone, today's video is about a topic that may be very interesting to you if it applies to your baby, and if not, you don't necessarily have to watch this one. But if it does apply to your baby, it's suddenly extremely interesting. So if you looked at yourself in the mirror and you stuck your tongue out and you opened your mouth and stuck your tongue behind the tip of your tongue, behind your top teeth, you will see in there a tiny little membrane that basically connects your tongue to the bottom of your mouth. It's called the frenulum. Well, we all have a frenulum. We're supposed to have a frenulum, but sometimes a baby can be born what we call tongue-tied, meaning that the frenulum extends all the way to the tip of the tongue. So you know how when you draw a heart, like on your Valentine's, and the tip at the top, it's got that dip in the middle? That's exactly how the end of the tongue looks if a baby is tongue-tied. And the reason that matters is because they really need to be able to fully extend their tongue to properly suckle, or particularly on the breast to be able to breastfeed well. And if they can't latch well because of a tongue tie, it can cause all sorts of issues. Lots of trauma to the mom's nipple, scabs, bleeding, extreme pain. But you can understand when the latch isn't proper, it also interferes with adequate milk transfer. So think about breastfeeding for a minute. We want ideally for that latch to be very wide open with the bottom lip flanged out, the top lip flanged up, and then we want sort of a nipple sandwich of the baby's gum and then the baby's tongue on top of the lower gum, then the nipple, and then the upper gum and the lip. So if that baby cannot extend its tongue to cover the lower gum, it causes all sorts of issues. There can be very loud, smacky latching. There can be poor weight gain because there's inadequate milk transfer. Because you know, those gums need to get far onto the breast tissue to massage the milk through the milk ducts. If they're just stuck on the tip of the nipple, that's killing the mom, but it's also not adequately transferring milk. So I have heard that years and years ago, OBs would even deliver the head and they're right on the perineum, would see their tongue tied, just grab a pair of surgical scissors and clip it. That was decades ago. And then it sort of fell out of favor. Then more recently, over the last several years, it's come back into the spotlight because of this potential interference with breastfeeding. So the way I was taught to clip tongue ties is very simple, very straightforward, minimally invasive. But there are multiple subspecialties in on this question of whether or not to clip tongue ties. So this is merely my opinion and my experience. I want you to particularly understand on this video that this is not specific medical advice to your child. It is essential that you consult your child's pediatrician, lactation consultant, or in some cases, dentist, or even an ear, nose, and throat doctor or otolaryngologist, which your general pediatrician can make that referral if needed. So the sort of tongue tie that I would deal with in the office with a frenotomy, so when you clip that frenulum, it's called a frenotomy, are just the very thin membranous connections, and sometimes that can make a huge difference. A lot of times I'll have a nurse or the lactation consultant to help me, and they will hold the little baby's hands beside of its head to stabilize the head and get the hands out of the way. And then I will place a gloved finger, I'm right-handed, so I place my left index finger underneath that tongue to lift it gently and expose that little tiny frenulum, and then literally I just make 1 or 2 clips. There is almost no bleeding at all, maybe 1/2 of 1 drop of blood. It's almost nothing. The baby may cry out for a second, usually not much at all, and then we'll try to get the baby latched on. The worst case is that it just doesn't make much of a difference, but in the best case, a lot of the moms will say instantly with the latch right after the clipping that they already feel the baby's latching deeper and it's a better connection. It's not as noisy of a latch, and they just feel like it's going better and it's less painful, which is of course our goal. And so I always try to warn parents, this may not make a big difference, but we really don't have much to lose because I only do those thin, not meaty, and very vascularized ones. I just do those little thin membranes in the office. So this varies widely. Many dentists can offer laser surgery, both for that and even for a tight anterior frenulum, the upper lip frenulum. Not that that's really been shown to make a huge difference with breastfeeding. It's typically the one beneath the tongue that can make a big difference. So In the lactation world, there's often also reference to a posterior tongue tie, meaning that it's much deeper and more meaty and muscular, and they want the babies to be referred to ENT. The problem is within the ENT world, they really don't feel like posterior tongue tie is a thing. So there is some controversy around that. Also, a lot of people just advocate for allowing the baby to use an artificial nipple like a pacifier. You remember pacifiers are slightly controversial in that we don't want you giving them to a newborn before lactation is well established because we don't want you to satisfy the baby. They're a pacifier. We don't want you to pacify the baby. If they're acting hungry, showing hunger cues, that baby needs to be on the breast to bring in the milk and get the weight gain back up. However, if we are using it on purpose just to help that baby try to stretch the tongue out, then that's probably fine. And sometimes we'll even do that after we've done a clipping to help them practice getting that tongue more extended. I'll even often just let them try to suck on my pinky finger, gloved, after the procedure just to see that tongue extend a little bit more. And that makes us so happy when we can see it coming out past the lower gum. Now, I've often run into cases too where in the hospital maybe someone questioned the baby might be tongue-tied, and then either because it stretched on its own or they were just being a little bit too stringent with their criteria, I don't know, but by the time I would see the baby in the office, it would cry maybe, and I could see its tongue all the way completely over its lower lip, and then you know you're fine. Never, obviously, would we recommend a procedure if it's not even necessary. So typically we would want to do a tongue tie clipping only if it's interfering with breastfeeding and the parents are very concerned. So I hope that's cleared up a few things. This matters completely on a case-by-case basis depending on the actual anatomy and the physical exam of your baby and how it's impacting your breastfeeding. But I would say to those breastfeeding moms who feel like things are particularly painful, make sure you get in to see your pediatrician or a lactation consultant so they could at least look for this one possibility that could be interfering with successful milk transfer. I hope that was helpful. If you found it helpful and you're not already a subscriber, please consider subscribing. Thanks.